Hi. Of the recent feedback regarding rheumatoid arthritis, I have an understanding that the malignancy, which could lead to cancerous formation due to the medication and the endocrine hindering the efficacy of, of its use. The previous study, however not communicated, indicates that rheumatoid arthritis mutates similarly and with the stubbornness of a tonsil cell. So continuously one can administer medication, however one knows the time period and the stubbornness of the tonsil cell, insulated by the sugar coating and thereby continuing with the inflammation and the swelling. It has been discovered through my research that the generic form of ibuprofen, given the stated, can curb the inflammation and the constriction of the arteries, thereby curbing the swelling and the pain accompanying the lack of transportation of oxygenated blood, obviously as known by the human species. Administering of the generic form of the ibuprofen obviously depends on the demographic of each patient. The areas are colder, requiring 3 doses prior prior the inflammation and the swelling and the constriction of the arteries or blood vessels. As the weather conditions worsen, the inflammation and the swelling worsens, as stated, depending on the demography. Therefore, each patient can thereby follow the instructions of the health professional after given the medication as indicated. Others, due to the heat, it obviously will also have indications of the rheumatoid arthritis symptoms, which is the similar to the extreme cold conditions, which is the symptoms worsening during the winter months. Therefore, avoidance of the heated area or the sunlight due to the effects because of the condition is the best one should take note of. Otherwise, other instructions related to the medication administered will be guided by each patient's health professional. This is proven, and some of the patients are well. However, one needs to take note of the thinning of the blood due to the consumption of the administered medication could result in nosebleeds, depending on obviously each individual and previous livelihood or previous demography, which could have been nosebleeds due to other reasons, not necessarily the thinning of the blood due to the consumption of the administration of the medication for the rheumatoid arthritis. My name is Qadisile Pretty Gumbi Gandaba.